bereavement. It was comparable to companion animal bereavement, but also really show, and also companion animal bereavement is, we have found comparable to levels of bereavement for human grief. So this all sort of ties in together. And one quote that we have up here that I would just like to read is, "I was surprised at how much more emotional I am over a service dog than I have been over my pets. I love my pet. I cry. I have a hard time with it, but it's different. It's really hard to describe the difference. It's a little bit more than just, I still don't like the word thing just because pets are not that either. But I guess that's what I would say. It's more of losing a human than it is an animal." And so, and the other quote, every time I thought I was somewhat healing, they would open back up because somebody would bring it up, and I'm like, okay, how am I ever going to get over this? So we put this up here to sort of underscore the intensity of the level of grief that we saw for these folks. Thanks, Phyllis.
And I forgot to mention at the beginning, but Nancy is really joining us, not only having a background in this, but also having a lived experience in the loss of a service dog. So Nancy?
Yes, thank you. Yeah, I have had a journey of combining my professional expertise on loss and grief with my own journey with my two service dogs, who I lifted up 9 months apart. I use the word lift up instead of put down, because that speaks to a kind of a really important aspect about facing loss and grief of any pet or human, or not human in this case with lifting up, but pet or service dog. I think there's a lot of truth to what these two quotes speak to. One is that it's very important and also sometimes difficult to find the support from people when you've lost your service dog, to really understand how it's different than a pet, and how even a pet is different than a human. So that's been my experience when I first was lifting up my first dog, Toaster, that people really didn't understand the depth of the relationship. So the role of the relationship, whether it's a human loss or a pet loss, including service dogs, is really one of the biggest factors that determine the grief experience. And all pets provide unconditional love and companionship. The difference between the pet and the service dog, which I think this quote is speaking to, is that we have somewhat of a different relationship and role, and they have a role that's different than a pet. Service dogs are like our partners. And so besides the love and companionship of a pet, they also provide services that we depend on, and we depend on them in ways that we don't even necessarily depend on humans. You can go to the next slide.
And so what Nancy was just talking to also speaks to another variable that we looked at in our research, which was centrality of event, which Phyllis talked about, the measure that we used. And this is the degree to which the memory of a traumatic life event forms a turning point in someone's life story, and it becomes the central component of their identity. So it's the way in which they integrate this event into their lives. And for our study, this predicted the reported grief levels for those experiencing death. So how much of a central event this was predicted the level of grief scores, which is an important thing to know how connected they really are, speaking to what Nancy was just talking about.
So in that context of the role of the relationship and grief, again, this speaks to when you're experiencing the loss or anticipating the loss, it's an opportunity. That time is really an opportunity to prepare yourself for grief. And I experienced a lot of this with both my service dogs for about the last 2 years of their life. I experienced the realization that their health was becoming more and more of an issue, and that at some point I might have to, face that loss. And the more I found that I prepared, I wouldn't say easy, but the less painful it became to go through that process. So I think there's a lot of hesitation for people to face loss and grief. And I've found that in my own experience and working with others, that the more you can face it, the more you actually experience some of the great parts of having a service dog with you, and recognizing and honoring them for what they've provided.
And Nancy, these are actually pictures of your dogs in the past.
Yes. So
About them.
Sure. So this is my dog Pink, Toaster's daughter. She's a Mexican hairless, a rare breed. And she became three-legged at the age of 1. And she was really, talk about in terms of role of relationship, she taught me so much about my own disability and learning to do things differently. And so as she became three-legged, she did everything else that she wanted to do and had done before her amputation, including the greatest retriever. Her middle name was Golden, Pink Golden Gordon, because she just loved to retrieve. So in the picture on the left, she's retrieving my Blackberry at the time, and she decided to stop and do doggy yoga. So that picture was a real illustration of the role of relationship, because she taught me about accepting my limitations and moving through them. On the right is a funny picture that I snapped of her, which reminded me about stress relief. So she often, reminded me to sort of just let go. That's what she's doing in that picture.
Thanks, Nancy.
I could also say, in terms of these quotes, that I think there is a slight difference between the experience of grief and loss when you're retiring a service dog that's different than the loss of the actual loss, the death of the service dog.
So as Nancy was mentioning, we are talking about, when we were looking at loss, we were looking at the loss of a service dog through death and through retirement, because they're both very different experiences, but very similar in many ways. And for both the retirement and the death sample, the level to which these individuals created meaning around the loss predicted the extent of their grief. And so we are, humans are meaning-making creatures. That's what we do. We create meaning in order to live a life that makes sense to us. When we can't create meaning, that's when the world feels scary and out of control for us. And when they can't make meaning, the event centrality in their life can really affect bereavement. And creating meaning has been shown in many different studies to serve as a buffer against the effect of a loss's centrality. And one of the things to really pay attention to when you're thinking about service animals as compared to companion animals is that there is a need for rapid and frequent replacement. When you lose a dog, whether it's through retirement or through death, you need another service animal. Most people who obtain service animals need these animals to live. And so there is not there's not always time for that emotional resolution, that ability to create meaning. You lose a dog and you need to get another dog pretty quickly.
So I think this slide speaks to something that I've experienced and other clients have experienced, is such a variance in how people experience grief and face grief and go through that journey. This person in this quote is talking about, being sort of not very emotional and looking more at the practical side of this loss that they're experiencing and the relief that they're not suffering. But for a lot of experiences that people have with losing their pet or their service dog is that there can be a lot of trauma and indecision through that journey. And how do people react if it's not an easy passing? I experienced kind of both sides with Toaster and Pink. Toaster's journey was much different in my letting her go than it was with Pink. Pink was sort of much more complicated with her health issues. And she was also grieving Toaster as I was within those 9 months, that she became more and more struggling, I guess. So what happens, I think, with people is that when there's unhealed grief, like, if they're not facing grief in the passing of or in the anticipatory part of their journey, it makes it difficult to open their heart to the next service dog. So when you talk about the rapid succession sometimes where people really need another dog, that's where really navigating this grief journey is so important, to be able to embrace another service dog, because I think the consequences of unhealed grief is that it puts a lock on your heart, and then it makes it difficult to incorporate another dog.
Yeah, thanks, Nancy. And we tried to include some quotes from the study that sort of bring more to life some of the numbers and the data that we collected quantitatively, because this was such a emotional and a difficult study for many people to talk about, that without having the ability to interview some of the participants and get a sense of what they're experiencing, we thought we would be missing a big piece of it. So we inserted some quotes just to let you know how some of the people responded to some of the issues. And so Nancy and Corey have alluded to the importance of social connections and social constraints and the difficulty of not being able to access people when you're going through a difficult time in your life. Disenfranchised grief, if many of you have read about the loss of companion animals, disenfranchised grief also means that society in general doesn't recognize the death of an animal in the same way that we do the death of humans. And so people don't feel necessarily supported, and they don't feel like there's anybody necessarily they can reach out to. And this even intensifies with the service animal. So if a person doesn't feel like they can access their support system when they lose an animal, then they're feeling very alone, very lost, and very disenfranchised. They're not, their loss is not recognized the same way it is with humans. Social constraints fits under a larger umbrella of experiences commonly referred to as disenfranchised grief. And again, that's something that's not socially acknowledged. So probably, I'm guessing many, if not all of you on this webinar have lost a dog in your life. And probably you know what that's been like when you try to process that with someone else who doesn't understand. I certainly know what that's like. And so I've always been selective in who I share that grief with. But again, it can complicate that process of losing an animal, and particularly when it's a service animal, because again, the depth of that and the uniqueness of that relationship is even less understood than it is with a companion animal. So that idea of lack of validation and failure to understand the meaning of that loss happens frequently for bereaved pet owners, but even more so and intensifies with the loss of a service dog. And their support system may not validate that profound depth of that relationship.
So one of the things that I experienced in terms of my own journey with chronic illness was kind of the same thing I experienced, and you're talking about now about pet loss, which is that people, I think in general, have a hard time with grief and handling their own and even knowing what to say to others. So this slide shows two greeting cards that I created at the time I was going through my journey with chronic illness and disability after a car accident. And I'd like to read this quote again. It's hard to explain because people feel like it's just a dog, but she wasn't just a dog. Because of her, I was able to do more things. She had to be walked, so I had to walk, and you know, she had to go outside. And when you think about this other quote, when you think about your close social support system is the death of your dog something you feel comfortable talking about with them? No, you're probably the first person I talked about it. So I think any kind of grief that's disenfranchised, like for example, this started with me with invisible chronic illness, which I felt disenfranchised through, that one of the things we have a responsibility to do and can do is to help educate people about loss and grief and what helps and what to say. And so I wrote this card. Let me see, where did I? I wrote this card to help educate people on what to say. So this card reads on the right, and that's a picture of Toaster. And on the left, of course, is Pink as a puppy. It says, "Don't worry, I got you, babe." So something even sometimes just that simple to say, "I'm there for you," is helpful. The card on the right says, "I'm on the lookout for you. And as far as I can see, you have everything you need to help you through, including me." So that's an example, I think, that really provides a good service to people, in that when you don't know what to say, we can help them know what to say. So part of our grief journey is to not hide our grief, but rather to, I think, say to people, you know, that really helped or that didn't help, and here's what would help.
Thanks, Nancy. Those are beautiful cards.
Thank you.
We talked about the difference too when we asked questions about the retirement cohort and the death cohort. And again, the retirement cohort is the handlers who, for whatever reason, realized their dog could no longer work with them. And Jen will talk more about some of the details of the findings there. But for whatever reason, they could be failing in health. They could be maybe too old to perform some of the tasks. But what we realized was that social constraints and the centrality of the event really predicted grief more in the retirement cohort, whereas in the death cohort, when they lost an animal through death, the only centrality of the event feelings predicted that grief. And so Jen is going to talk more about the details of these findings later.
And not to put too fine a line on it, but when we're thinking about disenfranchised grief, as we've been talking about, and as many of you who are at this webinar understand, I think it's really important to be able to understand sort of what people who have service animals sort of go through in the sense of the disenfranchised part. So they lose an animal, the animal retires, and then for many of them, they have to get one so quickly. And so here you are grieving this animal, and people are like, well, you have another, your other animal is right there. And it's such a disconnect, and there's such a disconnect between what you're actually experiencing versus what's happening around you in many ways, which is a lot of the stories that we got from these people, which yes, we will talk more about. But I think the disenfranchised part and this feeling that you really can't really let other people in because they won't get is such a big part of this. So continuing bond theory. So, in Freudian times, people, the way people thought was healthy grieving is to completely disconnect from the object of your loss. We know now that is actually not as healthy as the idea of staying connected to the object of your loss, even though they are not physically here anymore. And so continuing bonds theory refers to the way we stay connected to our loved ones who have died. So even though they are physically gone, we can stay emotionally connected through these continuing bonds expressions. And while they were initially studied in human loss context with KLAS, KLASS, more recently, researchers have investigated the role of continuing bonds in pet loss. And the types of continuing bonds include holding on to a pet's possessions, having dreams or reminiscing about a lost pet, creating a pet memorial, just having, washing fond memories over you as you think about them. And these findings have meaningful clinical implications for bereaved service dog partners. Our results confirm that individuals engage in continuing bonds following the death of their service animal. And each continuing bond is unique to the individual. And while some people adopt several forms of continuing bonds immediately upon death, others may develop them later or not at all. I mean, and it should be noted that continuing bonds experiences often change over time. And it's not whether a person experiences continuing bonds or engages in continuing bonds expression that is most critical, but rather the degree of comfort or distress that is experienced from a particular kind of connection. So I used to run a pet loss support group in San Francisco. And I used to ask a question to people: how do you stay connected to your loved one? And some people would say, I look at pictures, or I would do this, and I would ask, does that feel comforting to you? And some of them would say, yes, oh my goodness, that stays comforting to you. And I would say, well, this is the thing to continue. And some people are like, no, it's not comforting. And the question would be then why are you continuing to engage in this? And many of their feelings were, well, I feel like if I don't look at these pictures, I'm never going to look at them. I'm going to forget about it. But research has shown that that's not actually the case, that engaging in continuing bonds, as long as they're comforting, is really healthy. And some of the ways in which we found from our service dog participants were, that they kept their dog's collar, or they had pictures, or they would include them in rituals with their new service dog as well. So thank you.
Yeah, and I think and there's no right or wrong. The level of coping strategies and continuing bonds is all the way from, as Corey mentioned, saving items or collars. I mean, I have an old house shoe that's probably 35 years old that one of my dogs have, and I know exactly where it is, and it's stored in a sack, and I'll probably never get rid of that. All the way to having dogs stuffed and having jewelry made out of dogs. So there's no right or wrong to the level of those types of strategies that make people feel better.
As long as they're engaging, as long as they feel like it's comforting, and knowing that it changes over time. What might be comforting now may not be comforting in 6 months.
Right. Thanks.
I think there's also an important part of this connection continuing on.
Excuse me, Nancy, just a minute. Jane, I think your sound is on. Could you mute? Thank you.
Mute yourself.
No, it's not me. We're all on that. Yeah.
Thank you. Okay, Nancy.
So I was
Unmute.
saying that I also think, I focus a lot on anticipatory grief and healing, and using that window of opportunity to do personal growth, to honor your pet, and to it really minimizes, not minimizes, but eases, I guess, the grief that follows. So I find that there's an important process with the continuing bond where you can connect, the connection that you can create before the loss is different than after the loss. So there's different bonding that you can do as part of the grieving process to prepare you for that continued bond after, like having a bucket list of creating memories that you will find comforting after the loss. So for example, on Toaster's last day, I took her and Pink in their stroller to a favorite place on the water that we often went to, and that's how we spent her last day. And that is just an amazing memory for me to have, that comforts me and continues that bond, because I have pictures and videos of that day. And then the other thing about doing things like this, before and after, finding ways of continuing that bond, is that it provides some closure. When you memorialize, like you were talking about, Phyllis, with ashes made into jewelry, that helps bring not just connection, but it also helps bring closure, which is really helpful. This slide is a picture of how I created an altar with Toaster's ashes and then Pink's ashes. And I think, again, this having this visibly, to me, brought a lot of comfort. And I think I have one client, for example, who did a collage of all these pictures of her 2 dogs that she lost within a year of each other. And she just putting that together, that collage, and looking at those pictures reminded her of all the good times and less of the last stages of that grief experience and the loss.
Thanks, Nancy. And I want to make sure and excuse me, because I was I've skipped some slides and I've gone back and forth, so I apologize for that. I'm trying not to do that. But if you see the slides kind of move back and forth, my apologies for that. And I want to make sure everybody is seeing the full screen. Are you able to see the screen okay? Okay.
Yeah. Phyllis, on that note, one of the slides that you skipped, I think, was about me talking about, I think it's number 12, meaning making, and I have my book there.
Let me try to go back
Sure.
to this one.
Yes. So what I wanted to share about that is my personal, kind of combining my personal and professional journey of anticipatory grief with both my service dogs. And this is one way that people can make meaning, whether, you know, they do a journal or they create something, but transformational grief work, which is what I specialize in, is about making meaning out of the loss. It's about using the grief experience and that whole journey to learn how to face grief, your feelings, and changes how you live, changes how you participate in the world. You know, for me, this title of the book, I Miss You Already, Bearing the Unbearable Loss of Your Pet, came about because that was one of my processes while I was facing losing Toaster and then Pink. I whispered this into their ear every day. Every day I was present with them, and I would say, I miss you already, and I could not love you more. And that, again, is another example of that continuing bond that I created with them as a ritual that I know they heard, and I felt that connection, and it kind of just helped me let go more. So making meaning is really, it's such an important way of having closure, and has so many, so much healing can be found in that process.
Thanks, Nancy. That's really important. And I apologize for skipping over that.
No worries.
Let me get us back to, okay. So, so we talked a little bit about the differences between retirement and death. And a death loss may happen unexpectedly. You know, it could be a dog who has a sudden illness. We all know that sometimes a diagnosis, particularly when it's around things like cancer, doesn't give you very much time, or it could be an anticipated loss. Again, I mean, it could be a diagnosis that, you know, you don't have that much time left. And so you try to make your time valuable with that dog. It could leave limited time to prepare for the transition to a new service dog, particularly if it happens quickly and it's unexpected. And again, as Corey had mentioned, having another service dog is sometimes quite critically important for people with disabilities who rely on those dogs. A retirement loss, on the other hand, is a little bit different. It does prepare more time to prepare for the loss, yet it also gives you more time to dread that impending loss. And again, for anyone who's had a service dog or a companion dog who knows that they have an impending illness or a death is coming or they're getting very old, you know what it's like. I have a friend and I tell her, but just enjoy every day you have with the dog right now. But that's hard for us to do. So it may include 4 types of transitions if you have to retire a service dog. You could stay in the handler's home, and that's an option, and is usually, and I think Jen will cover this a little bit, is usually probably the choice that most people do. It also adds challenges to that, because then you have 2 dogs. Rehoming to the puppy raiser, so that's also another option, and that organizations were willing to take those dogs back and find a good home for them. Rehoming to a stranger, or rehoming to a trusted family member or a friend. And again, that means you're giving the dog up, but sometimes it may be easier to separate from that dog, because then you don't have the 2 dogs. And we know, and I think Jen will talk about this, that service dogs are so stoic and they have such a work ethic that they will do anything to continue to work. And so when you have to say, you know, I can't take you, I'm going to take this new puppy now. It's hard on you. It's hard on the handler. It's hard on the dog. And so all of those issues are things to be factored in when you are thinking about the retirement of a dog. So Jen, I think you're going to give us some of the results of some of the study now.
Yes, I am. So I'm going to shift a little bit. This slide is particular looking at retirement dogs. Dogs when they go through retirement, and looking at the ambiguous losses associated with this experience. Phyllis shared, the 4 main categories and ways that people can retire their dog. And with, we interviewed Canine Companions members, or members of their group, or individuals who received their dogs from Canine Companions. Used to be Canine Companions International, but now it's just CC. So in these individuals, typically around 8 years of age, they start planning, and they even plan from the original meeting their dog in the initial training. But around 8 years of age, they start meeting or having conversations with their CCI trainers to think about and to prepare for when this time might come. As Nancy mentioned, it's when you can be mindful of this process, it can sometimes make it a little bit less stressful in thinking about the details about where they're going to go and how this will be. And as we know, for many people, our pets, especially if we don't have a child, become like a member of our family, and we care for them immensely and want to make sure that they, as a child, would have a place and a safe place to be. So a lot of the service dog handlers shared with us in their interviews that they want to do good by their dog. They have felt that their dog has provided them a sense of independence and hope and a way to connect to the world that they haven't had before. And so for them, they want to be able to provide to this dog that has meant so much to them, their partner, the opportunity to have very good moments through the end of life. And so that's a lot of emotional weight to hold. It's a lot of details to organize. And so we'll share with you a little bit about how ambiguous loss appeared differently for dogs, the handlers, when their dogs were going through retirement than they did through a death. And so for many, we know ambiguous loss started way back in the 1970s with Pauline Boss, and looking at soldiers when they weren't returning home and what that experience was like, because we didn't know if we were alive, but we knew that they were alive, but we knew they weren't with us. And so this is very similar for service dog loss through retirement, because sometimes it can be even harder to pinpoint. And it can be many, many, many losses, which are less concrete. And I think for many where their service dog stayed in their home, it was hard, particularly if a successor dog came in their lives. And so being able to tell when the service dog heard a noise or knew of a certain cue, that they instantly responded, because that's what they do. And so telling your service dog that, okay, now I have another dog that's here to do this for me is impossible. They don't understand that. And so it's really a training challenge to figure out how to navigate that. And also, as you see in this first quote, she's with me all the time. So it sort of becomes a habit, like when you look for your child in the back seat. And this automatically, if you are going somewhere and your service dog goes with you, and you have a new dog and you're ready to go in the car and go, and can you imagine the face? We all know what puppy dog eyes look like, and how to leave that behind in the window or in the glass door, front door, to see that face and be able to explain that is really hard. And so it's just loss upon loss that kind of builds up, going from our anticipatory grief all the way through planning where our service dog will go. And this is where the social constraints come in really, I think, vitally. And it's who is our support system, not only in helping us emotionally, but in practically. So if a service dog handler has a physical illness or a disability that limits them from being able to provide physical care for the dog, it becomes even more challenging if they live alone, because they can't, as their dog maybe is going through an illness that requires a lot of physical help and bathing or going back and forth to the doctor. That can be hard if one lives alone and also has a disability. And so also thinking about who are your contacts when it comes time to rehome, if it's not possible for your dog to stay with you. Where can your dog go? It can go to, do you have a friend, family member that is close and understands and would treat your animal like you would want them treated? Or for many folks, their puppy raiser was an essential person in their lives to help them understand what they were going through, because they knew the traits of the dog. They'd spent years with them, training them. And oftentimes the puppy raisers would be willing to come and pick up the service dog and bring them back home and spend their final days with them. And so for many, this continued bond could stay because they would send pictures, they would still meet for picnics. And there are many ways that the puppy raisers really truly understand, not 100%, but knew best what this was like. Next slide, Phyllis.
Minute, I'm trying to get there. Okay.
So Nancy.
So yes. So this is a picture, again, kind of another representation of that continued bond, and brings it, this, just looking at this brings comfort to me, because this is a picture the day after I lifted Toaster up, and Pink was her daughter. So Pink lost her mama, and we were in bed. I got pneumonia. And so we had 3 weeks of basically grief together. And so we're holding each other there, comforting each other. And it was such a, I was facing my grief about Toaster, but I was also facing Pink's rapid decline that started before I lifted Toaster up, but continued and escalated in terms of her health issues right after that. So that was really a difficult time to be managing all of those pieces. And I think when you talk about how to incorporate a second dog, another service dog, that it's so important to do the kinds of closure things and continued bond things you were talking about, Jen, because when you don't heal that grief and loss from the first service dog, it makes it hard to attach to the second dog. And I want to say something about this part of this quote: you just can't prepare for it. That's true and not true. That's what I experienced was really a transformational piece about dealing with grief and feelings for me, which was to be able to learn to hold both the sadness and the grief with the joy and the letting go and the continued bond. So you can prepare for it. That's if you have the window of anticipatory grief, whether that's looking at the death or retirement, the more that you face that, the better prepared you are. And to acknowledge really that on the one hand, you can't prepare for it, that, what comes up and how people experience that actual loss is, there's an element you can't prepare for, but there is a lot you can prepare for. And again, when she says, she feels like it messed up her relationship with her second dog, that again, I think is partly probably because she hadn't really fully grieved her first dog.
And we also know that no two dogs are alike, and it's always easy to compare one dog to another dog, particularly a dog who you've relied on and had for a long number of years, and then another one comes in and it doesn't do things the same way.
Right.
So we expect for them to kind of replace. And like you say, if you hold both of those, you can't replace the other dog, but you can hold the loss of the other one and still hold the love that you could create and develop for the new dog.
Right. And I think that's really speaks to a good point about using grief to transform who you are and how you are in relationships. Because if you are really looking at your whole journey and your process and your feelings about this conflict with the losing the dog that and having another dog that isn't like that dog and maybe more difficult, more challenging, but therein lies the possibility of personal growth. You know, that second dog, service dog, can teach them a lot. I don't, you know, about anything in particular, but that's an example of how you can manage all of that and make it work for you.
Thanks.
Mhm.
And I think Jen's going to pick up with some more of our results and recommendations.
Sure. And I could speak a little bit more in what Nancy was sharing, and that oftentimes people had what they called kind of like their number one dog or their angel dog. Often it was first dog or their heart dog. And so recognizing that, you know, not all dogs are the same, and they all touch us in a different way. So be able to provide that space to talk about how each one is different, and not to devalue a dog in any way, as Nancy's saying, right? They each have a different place. And so being able to be there and be present when a new dog comes, and maybe the new dog, successor dog, as many people called them, might not have the same skills yet. And so it's helping to support patients, in particular if someone is independent and requires independent of others, but does require their dog to open the doors so that they can get food, to be able to make alerts, open blinds, all kinds of different activities that we require our dogs to do to be able to stay independent. So being able to help people be patient if the new successor dog does not have all those skills. And maybe sometimes it requires going back for touch-up training to get those skills for a couple of days. So some considerations for service dogs during physical exams. We heard a lot about health decline stories, and oftentimes that maybe things weren't picked up quite as quickly as one would hope. And part of that has to do with stoicism, and meaning that the service dogs, that is how they're bred, that is how they're trained to be working dogs. And so for them, their sole purpose and meaning in life is working and being able to do what their handlers need. And so sometimes we heard from the participants that they would bring their dogs to the veterinarian and would say, you know, there's something that's just not right. They don't have the amount of energy. They're limping. Can you check this out? And times, because of the stoicism of the dog, they had an advanced illness that, you know, maybe in a dog that was a pet dog might have been discovered earlier. So one of the big messages we heard, and a theme from our data was, you know, these dogs are stoic dogs. They're going to work beyond probably what their bodies can tell us that they're going through. So you'll see a couple of quotes there. But one thing also really important, and depending on the role of our service dogs, is dental hygiene. And oftentimes, you know, we go to the dentist and with our pets and have their teeth cleaned. But for a service dog, they need all of their teeth, because oftentimes they have to pull wheelchairs. They have to open big, heavy doors of refrigerators. They need to be able to grasp with their teeth to pick up credit cards, to pay bills, to grab money and exchange things. So dental care is extremely necessary to bring up from initial visits with the veterinarian, to make sure that they're checking for those kinds of things that maybe we as pet owners might not think about, but as a service dog handler, it's vital to have these. And then our next slide will be some questions that our participants shared with us about. We asked, one of our questions was, you know, what would you like other service dog handlers to know? What questions could they ask themselves to kind of help prepare for some of these transitions? Because as we've been saying, having this knowledge can be really helpful in preparing ourselves emotionally and practically. So I'll read a couple of these questions, but these are things that we could encourage you, and we even have a scale coming up that you could provide with clients you're working with. to help them make these decisions, because sometimes it's hard to even know where to start. So is your dog keeping up with you or falling behind when you go for walks? Do they seem a little bit more lazy? We'll use the word lazy, or taking a leisurely stroll. Do they start out okay, but maybe they get winded or have a hard time getting up if they stop midway on their walk? Are they limping in the morning more than usual? Are they having selective hearing? But maybe there's something going on that they can't hear because it's bigger than just hearing a loss. Maybe there's a tumor somewhere that's impacting their hearing. So these are some of the questions that our service dog handlers shared with us that they thought would be really helpful to pass along to others.
Can I just add something?
Yes.
Jen, and thank you so much for that. It makes as clinicians, for those of you at this workshop who are clinicians or are service dog partners yourself, I think one of the things that came up for us is this idea of empowerment and ability to assert what we believe to be true. And we found, a lot of, as Jen was saying, a lot of the service partner participants, really felt like something was wrong with their dog, and to support them in any way possible and encourage them to develop the kind of skills to say, I believe this, even though their vet might say it's nothing, don't worry about it. And I think that this idea of sort of empowerment and assertion is a really, really important one to kind of put out there. So thank you.
I also can add to that in terms of stoicism, and speaking to, what you're saying, Corey, is that when you have a service dog, there is the potential, if not the inevitability, of really deep communications between the two of you. You really can know your dog and what they're feeling and what the changes are, and even the subtle changes. So the more that we can encourage and respect that level of communication between the partners and between the vets, and like you say, really communicate that I know my dog and this is what they're telling me, it really will help increase the collaboration with the vet. And like, for example, a good example of this level of communication, towards the very end of Pink's life, her service, I didn't explain this, but her and Toaster's service were to provide the warmth of a heating pad. So before I got Toaster and discovered this breed, which is known to be hot against your skin, so like a heating pad for muscle pain, I had a 24/7 microwave neck wrap. And when I got Toaster, she became my 24/7 no microwave hot dog. And so they spent their lives. Toaster was 17 and Pink was 14 when I lifted them up. And they spent their whole lives helping my pain. And when Pink, was getting, really, really sick, we had this conversation when I was really kind of coming to terms in my own anticipatory grief with her, that I was probably going to have to let her go. And we had this conversation, literally, where I was crying about it and talking to her about it. And she got on my neck, which she hadn't been doing. She herself had kind of retired a lot of times in those last couple of months, I think, because probably the level of pain she was in physically. She got on my neck. She sat on my neck for just, I don't know how many seconds, not very long. She jumped off, went on the floor, turned and looked at me, and basically said, I can't do this anymore. You can let me go.
Thank you, Nancy. Wow.
And Nancy, I love what you're saying about just the communication and the depth of being able to read each other's minds and bodies. And part of the hardest part is not knowing what they're saying. But I think if you have that relationship as a partner, you get this deeper sense of connection. And you can advocate and say, I'm seeing this. And sometimes it's, I know I have a hard time being persistent and really advocating for myself. But I think it's that, you have the insight that someone that's not there with you all the time can have. And we heard a lot of folks that they were changed by their first loss of their service dog because they learned to better advocate. They went to the veterinarian earlier. They asked for labs that they typically didn't ask for. And so it really changed the future care of their other animals. Yeah.
And that is such a great example of transformational grief, of she used her experience of her grief and what she would do differently with her next dog and probably person. So that's beautiful, beautiful example.
And we share with you now 2 examples of it's the same scale, but they're done differently to help folks, and maybe one speaks better to another. But this is from an article, Oncology Outlook by Dr. Alice Villalobos. It's a quality of life scale, which helps to make the final call. So it's the scale. And this and the other are examples from pet hospices, which is another option for folks to know that that's available to support you in making these decisions and providing comfort at the end of life. So this quality of life scale helps people to know when they should, as Nancy says, lift up their dogs. So these are the general categories on the left, the quality of life factor in terms of pain, hunger, hydration, their hygiene, happiness, mobility, and then in general, are there more good days than bad days? And so, you can point these up on a scale with 0 being the worst possible and 10 being ideal. And then this sort of the cutoff score is at 35, representing acceptable quality of life, and to continue with hospice. But anything above that, below that is maybe helps folks to consider that maybe it might be soon time to lift their dogs up.
So this is a picture of one of my greeting cards. This is called Surrender Without Giving Up. And that's actually the first of my 7 practices that I helped transform loss and grief through and used myself. This is a picture of Toaster. And I think when I read these slides about the QOL, I couldn't help but note there was a piece missing about how you make this determination of letting go, whether it's retirement or death. And that has to do with really more of the whole emotional, psychological, mental, spiritual experience of death and dying and letting go. So Toaster, I had a very different, so this was a step, Surrender Without Giving Up, that I faced early in my journey when I went on disability. I had to quit my private practice and make that decision. And it was very tough. And I thought I was surrendering when I let go of my practice, but really I was just giving up. So what I learned about through that journey, and what Toaster and Pink also taught me through my whole relationship with them, especially Pink because she became 3-legged, was about that aspect of surrendering your dog, not just literally retiring your dog and surrendering, but actually going through the whole emotional, mental, and spiritual process of that loss. And Toaster taught me about, I call it 2-sided surrender. The practice, because it's like the same coin, but a different experience. With Toaster, she taught me a different level about coming to terms with what is. I really had to face, for the first time, surrender in terms of accepting that I was going to have to let her go. and she was the first of the two. Pink, on the other hand, taught me the other side of surrendering, which was about letting go. So there's accepting and then there's letting go. A lot of people mix them up in terms of using the word surrender. But I found that it's the same coin, but there is a difference. There's a different side. So Pink taught me about how to let go of her, like as I gave in that example of our last conversation about it. So I just wanted to add that piece.
Thank you so much, Nancy. And thank you throughout for sharing your professional and personal perspectives. I think it really adds so much to the richness of our presentation and hearing from you and all these different transitions and phases and how you approach them and how that transitional grief has looked for you.
And I'm grateful to learn all about your research, because it's like a win-win. You know, you kind of validate what I'm saying and I help you illustrate it. So really is
That's a perfect way of putting it. Yeah. Yeah.
Great. I think, Phyllis, that's our last.
Yeah, so I think that concludes the presentation. We have about 15 minutes for questions. Jen, do you want to say something about the exit survey?
Sure. I'm going to put in the chat the message for you for the exit. Just as a reminder, we need to have you hang in there for 80 minutes. So till at least 20 after, but I just put it in there. You'll see you need to have provided your email at sign in, but also at sign out. Please don't skip that, include that. And then you'll see the link here in the chat that you'll go to for your exit survey. So fill that out and read the CE terms and conditions on that form. And those who meet the attendance criteria will be sent an email in the next 30 days that will allow you to complete the evaluation and request your CE certificate of attendance. So thank you so much, Phyllis. That's what the form looks like. So the sign out form there.
Okay.
And we want to thank everyone for being here, and we would really love any questions that anybody has.
So I'm going to stop sharing at this point and look in the chat and see if we have any questions. I know we had a couple of comments. Someone commented on the stoicism of their own dog, who was not a service dog, but really realized that he was still very stoic. Let me see if there are any questions. Did you find a difference in coping mechanisms, difficulties in children versus adults? We
didn't survey children. All these service partners were adults. So we didn't look at the differences between, but I'm imagining there definitely would be, for sure.
Yeah, as I think about that, and I wonder if children wouldn't even be, because, you know, it amazes me how children can overcome a death easier than adults sometimes. And so they go on with their life, and maybe it would even be easier for young children to accept that death and move on than it would be for an adult. That's just a thought that I had, but.
Well, it's probably, as you know, it happens if they do have a service dog when they're young. It's such a part of their life that it is sort of like getting a service dog and then losing a service dog becomes
Right.
sort of the norm.
Right. So someone said they didn't get to sign in at the beginning. Jen, I don't know, can they?
I'm sending an email now, but I can put, I'll just go ahead actually for everyone, put Lori's email in the chat. I apologize. We are stepping in with housekeeping details and I didn't get the memo as to what to do if somebody missed that. So I will put that, Kina, and for anyone else in the chat, I'll add Lori's email. I just want to make sure I get it right.
We can actually do that now, Jen.
Oh, hi,
Oh, and I
Lori.
was going to say,
Good to see you.
I jumped back in at the very end. So yeah, they should be able to go in and do it now.
Thank you, Lori.
Debbie, I want to say that is no, not yet. I want to say we haven't conducted any studies for neurodiverse individuals yet, but our hope is to continue looking at the nuances and specifics of different populations of service animals, for sure.
And someone asked about accompanying your dog through palliative care as opposed to euthanasia.
I can speak to that a little bit. I think that's a really, really important question. And it's one that I grappled with Toaster about whether I could actually go through with euthanizing her. I think one of the main parts of that choice about going through palliative care through their process and letting them die on their own, I assume that's what you're talking about, is again so important to anticipate the grief and how you're going to handle that as you watch your dog potentially suffer, and how you can prepare yourself for those last moments when they take their breath on their own. I experienced that with my sister and her dog. She decided to let her dog die naturally. And I'm not so sure that she was glad she did that, because at the very end, it was really, really painful to watch her dog die, basically. So I think it's really helpful to make sure that people have an idea of really what they might be experiencing emotionally and mentally for that process. There's no right or wrong choice. I think it's just all about the journey and making it not traumatic for the dog or the person.
Thanks, Nancy. And someone said, yes, sometimes it only seems to adults like it's easier for children. And that's a good thing to remember too. Someone asked a question about, about canine dogs, about police dogs. And would there be similar things? Lori and I actually did do a study some years back there, and Lori is free to comment on this as well. There are a lot of similarities. I also remember the things that stood out were that, again, it's a very unique relationship, and it's a relationship which is interdependent. They rely on each other. The issue of retirement and loss and rehoming, I think, is very similar to the service dog. I do remember something that stood out, and recommendations for veterinarians is to make sure that the veterinarian understands that relationship if they're treating a dog, or if a dog has been injured, let's say in a shooting and has to go to the vet, but to be able to voice to the veterinarian about that relationship and what the handler needs as far as being present and being available with the dog. It's not unusual sometimes, if it's an emergency situation, for the veterinarian to take the dog away and say, we need to care for it. We're going to take it into a back room. And I remember there were some preferences that said, at least let us go back with you. We know how to handle the dog. We understand if the dog needs to be muzzled or not, but our presence there will provide some calming effect. So I don't know, Laura, if there's anything else from that study, but it is similar kinds of dynamics to this. I'm curious how this could apply to therapy and or working dogs. My thought is that losing a working dog could be more than losing a pet, because they are losing that much more of a partner. And I think that's true with therapy dogs as well.
And I want to address Jessica's comment at the end about when to start preparing. In thinking of adults or children, it's never too early. You don't want to, you always want to be in the present, right? Like I look at my dog, and we talk about this all the time as people who research pet loss, right? Or death and dying in general. We don't want to be like, you get a dog or any animal, unless it's a bird which will outlive you for the most part, or a tortoise, but you never know. But you get any animal and you know for the most part that you are going to outlive this. I mean, all things being, you know you're going to outlive this animal. And so you don't, like, I look at my dog sometimes every day, I'm like, oh, she's this old, like I want to celebrate her birthday and at the same time want her to stay the same age. But we want to live in the moment. We don't want to think about that all the time. But I think it's a really important thing to just be able to acknowledge, you know what, this animal is not going to be around forever. And I really need to acknowledge that so that when it comes up, I'm not like, I can't believe this is happening. Because while it feels that way, you know that this is going to happen. So the feelings and the understanding can be very disconnected at some time. So I want to say, yes, I agree that the earlier you start acknowledging this, the better. And I think with children, I think that the way in which you acknowledge it is different, but I think that the idea that, this idea with children, which I truly believe, is that, this idea that no carbon beings last forever, that all carbon beings are not going to be here, I think is an important kind of concept.
And I would say, Jessica, in terms of the last part of that question about to be prepared even before anticipatory grief is present, that just recognizing that there is going to be loss is in part anticipatory grief. That's it. And I like explaining it that way because it takes all the angst out of anticipatory grief when you do this. So yeah, I think it's never too soon. I know I had thoughts about it for many years before the last 2 years of Toaster and Pink. And it shaped, this is again where transformational grief really is amazing. It shaped how I continued my relationship with them, and how I lived my life daily, and not just with them, but it became part of just who I was, and in terms of relationships and life, and not leaving uncomfortable negative conversations unhealed, for example. So never too early.
And I think Deborah made the comment, loss of a therapy dog also is a loss for the clients that they have to process as well. And I worked with kids in an equine program, and I know one time we lost one of our horses, and we had to help them process that. I think it helps the children understand, as someone said, that everything dies, that nothing is permanent and lasts forever. And so it helps them to understand and process that loss. But I think it also has to be done in a very therapeutic way, because it's not just the owner, but it's also the client who's been working with these animals. And someone made the comment, and I agree too, the phrase lift up as opposed to put down is just a beautiful way of talking about that. So thank you, Nancy.
You're so welcome.
And I just want to make sure to note that I put Nancy's information in the chat box if you want to follow up with Nancy. It is there for you.
I know, Linda, sometimes we just don't want, it's painful. This is not easy stuff we're talking about, and there's no, it is painful, right? And sometimes denial is not a terrible coping skill when used in doses to kind of help alleviate the pain.
Absolutely.
So I'm looking through the chats. I think with let's see.
Can I make a comment to Linda about her comment here? I think this is something that you experience that you can grow from, that facing and the grief is is so empowering, and it's so honoring of yourself and your dog, that as you experience that benefit of it, the benefit of facing the grief, it becomes easier to grieve. I'm not saying it doesn't hurt for sure, but
But maybe it's a healthier way.
it's bearing the unbearable. That's why I wrote this book on I Miss You Already, anticipatory grief. It's like bearing the unbearable. You're watching it unfold, but there's a lot of healing that can take place in that process.
So I think we're just about out of time, Lori, right? We have about 2 minutes.
That's correct.
Okay. I want to thank everyone again for joining us, and I hope that this gave you some insight and some ways to look at grief and processing that grief, whether it's a service animal, a therapy dog, a therapy animal, a companion animal. We hope that this was helpful in some way.
Thank you all for joining us today. So nice to meet you and sharing this time with you.
Thank you all. And again, thanks to Nancy for sharing your own experiences. That was really, really brought it to life.
Yes, Nancy, it was such a pleasure to have you sort of illuminate all that we do in such a beautiful way.
Thank you. I'm so honored to be here and so glad it was of service.
Okay, I think we're about to sign off then.
Yes.
Thank you, everyone. Have a wonderful day.
Bye, everyone.
Bye.
Bye.